All right, here we go. Hello, everyone, and thank you for watching this presentation on DC-PT-MD integration. There's no audio taping or video taping allowed, and any unauthorized reproduction or forwarding of this target coding presentation is illegal. The information contained in this presentation is for educational purposes. It's not intended to be a substitute for your thorough clinical decision making. It's not intended to be legal advice. Target coding does not engage in providing legal services. CPT is a registered trademark of the AMA. Every attempt has been made to make certain that the information in this presentation is 100% accurate. However, it's not guaranteed. A little bit about myself before we get going here. My name is Dr. Marty Kotler. I'm a chiropractor. I'm also a certified professional compliance officer. I'm a certified billing and coding specialist. And, I'm not necessarily the insurance guy. I'm more of the compliance guy because it really doesn't matter to us here at Target Coding if you're an all-cash practice or an insurance practice. We just want to make sure you're compliant with all your billing and coding and you're following all federal and state laws. Just want to make sure that doctors are maximizing reimbursement and you're not leaving any money on the table. I've written many books on billing and coding. I've written many training manuals on documentation and compliance, not only for chiropractors, but for acupuncturists and for physical therapists. I'm a contributing writer to many publications throughout the industry on chiropractic, physical therapy, and acupuncture. And I am a guest speaker at many state association conferences nationwide. So, all right, let's get going now. So, there are pros and cons to DC-PT-MD integration. I'm going to share with you some of the cons because it's not for everybody. There are some doctors that I actually talk out of going into integration. So it's not maybe the rosy picture that some other groups paint when it comes to DC-PT-MD integration. Overall, I think it's a good thing, but it's not for everybody. The positives, you see, I was chiro only in my practice the first 12 years, and then I decided I want to integrate my practice. So I'm going to share my trials and tribulations. I'm going to share my clients' pros and cons with this. But again, overall, it's a good thing. What I liked about it, and many of my clients like about it, is the fact that you can co-treat patients. See, before I was integrated, patients would come in and I was, in control of their situation. But there were times where I'd look at an x-ray and go, I wish I had another set of eyes that could take a look at this and give me some ideas. This patient, isn't getting well as I anticipated, so oftentimes I'd have to take my records and I'd have to go to a friend's office, or they would have to come over to my office and we'd share and see how we could help patients. And oftentimes I'd bring my x-rays to a radiology center. I had a friend who was a radiologist, him to look at my x-rays. But now that I had other healthcare professionals right there in my office with me, it was just a nice way to take care of patients. It added a whole nother dimension to my practice. When I was chiro only, where I practiced, I had to do the therapies. In the state where I practiced, CAs were not allowed to do the ultrasound and do the therapeutic exercises. So I was doing it, or my associate chiropractors were doing it. Well, if you bring on a PT and you bring on their healthcare professionals, then you don't have to do it anymore. That was a big relief for me, that I didn't have to do the therapies and the modalities anymore. It will add additional services. It'll add a whole nother department depending upon what you bring in, and it'll add a lot of additional marketing opportunities. So there are a lot of positives, but there are plenty of negatives. You're going to have more overhead. You might not be able to afford doing this. For example, if you want to bring on a medical doctor, a medical doctor might cost $150,000. Do you have $150,000? You have $3,000 a week to pay a medical doctor for, the salary to work in your clinic. So more overhead, you may need more room. I know one doctor right now, he'd love to integrate. He has 500 square feet. He's in a tiny little office. It just wouldn't work. Other costs, malpractice costs, it may add confusion to existing staff. Again, back to my practice, I had some CAs that were with me for many years prior to me integrating. I was their only boss. And now I bring in some partners and other healthcare professionals. Some staff members didn't like the other doctors. They just liked me, so it was a little stressful for some staff members, and some staff members quit. So it could be a little confusing to staff members when you transition. It could be confusing to patients. Wait, I just want to see the chiropractor. I don't want to see the PT or the medical doctor. Turnover, you could have some doctors that are working with you in PTs, and then after a few months, they get a better offer. They leave, and then you have to hire new staff. That happens just in a chiropractic office too. But when you have multi specialties, you have more staff, there could be more turnover. So those are some of the negatives. But again, overall, it's a good thing. So now let's talk about the corporate structure. There are 3 corporate structures, basic 3 options here. You may be able to find an attorney that could, get a little bit more creative. But, I look at these as the 3 basics, employer-employee. So let's say you are the employer. So you're going to do all the billing under your tax ID, and you're going to pay all the MDs and the PTs salary. You're going to receive all the money, and then you're going to take away the MD taxes, salaries, overhead attributing to the MD, DC, PT services. Make sure you get an attorney that puts together a comprehensive employment agreement. And that should include duties, responsibilities, compensation, malpractice, arbitration, non-solicitation, all those legal things get covered, get protected. And then partnership. Partnership, terrific. All the billing goes out under the group tax ID. All the partners receive compensation attributable to the entire practice based on ownership in the business. And then again, you're going to want to get an attorney to put together some sort of operating partnership agreement that includes information about, contributions to the practice, financial distributions, day-to-day management, significant decisions, delineate duties. That was one of the issues in my practice. One of my partners felt that he was doing everything he was supposed to. Everybody else disagreed. There was tension, there was stress. So that's because we didn't delineate the duties the proper way when we first started. And then you may need to form a management company which provides services to the medical corporation, like marketing, payroll, staff management, housekeeping. And the management company charges the medical corporation a fee, which should be fair market value. It should be at least 1 year in duration. The fee should be set in advance. It shouldn't be based on patient referrals. And then you could rent space. If you're not ready to jump into this, and an MD or a PT or an acupuncturist that wants to work with you, but you're not sure you're ready to jump into this and you have room, rent space to the PT for a few months and see how the relationship is going. You could refer patients to the PT. The PT could refer patients to you in a rental agreement. It's okay. So the PT or the MD would do his or her own billing. The MD PT would pay you rent. It should be fair market value. Now you need to get an attorney again here to create some sort of sublease agreement if you don't own the building, and specify the space and equipment to be used. It should be at least 1 year in duration. The rent is set in advance, and again here it's not based on patient referrals or volume. Next, how do you find staff members? Why would this is a question I often get, Dr. Kotler, why would a medical doctor want to work for me? Let them go, don't they want to run their own practice? There's a lot of reasons why other healthcare professionals would want to work for you. Maybe you wouldn't even, think of the reasons, but they just might not want to run their own business. Maybe they just want to work part-time. They don't want to work in a hospital anymore. Maybe they're just young and they just want to learn more about, they just want experience running a practice. Some healthcare professionals, they're just not entrepreneurial, so they want to work as an employee. They don't want to deal with new patient marketing, so there's many reasons why staff members would want to work for you. Now, I break down staff members into two categories: QHPs, qualified healthcare professionals, and clinical staff. So QHPs, these are healthcare professionals that are qualified by education, training, they're licensed, and they can perform a service and independently report that service, basically bill insurance companies. See the list? Medical doctors, osteopaths, chiropractors, PTs, PAs, and then there's clinical staff. Clinical staff is a person who works under the supervision of a DC, a PT, or an MD, and they're trained properly. They know how to perform services. However, clinical staff would not be able to independently report that service to an insurance company. CAs, medical assistants, nurses, nutritionists, aides, PTAs. A little bit about nurse practitioners. Very commonly incorporated into DC, PT, MD practices. There are about 150,000 nurse practitioners in the country, about 190,000 PTs, and about 65,000 PTAs. Just about the same amount of PTAs as there are chiropractors. PT, NPs and PAs average salary about $80,000 a year. They're licensed in all states. Excellent QHPs to have on the team. Now, who could provide the services? You know, the state rules can be complex. Sometimes they're hard to find regarding supervision. And like I said, you know, in the state where I practice, CAs were not even allowed to perform hot packs. So want to make sure that you know the state rules. You want to check with your state board on the types of QHPs and staff members you can employ. For example, there are some states where chiropractors cannot employ PTs. So don't just hire a PT and pay that PT a salary. That would be against your scope of practice. In some states, you can't hire the states that you cannot hire a PT. You may be able to form a corporation and partner with a PT. So that's where you want to check with your state board. Now, again, how do you find these staff members? One of the best resources, your patients. Whenever I needed anything in my practice, I always looked to my patients. If I was looking to do some electrical work around my house, I checked to see if I had any patients that were electricians. If I was looking to buy a car, if I had a client that was a car salesman, I would always ask my patients. I found one of my PTs. I would ask patients, hey, I'm looking to integrate my practice. We're looking to bring in physical therapy. Do you know any physical therapists looking for work? One of my patients happened to have a friend who was looking for part-time work. Ask your patients, contact hospitals, job placement sites, placement agencies. Put ads. If you have to put an ad in the paper, here are some ideas. Great position to work. In a growing state-of-the-art facility, we emphasize high-quality care, experience desired but not required. Is speaking another language important? You may want to indicate that a background in sports injuries or post-surgical care is needed. You may want to put in the ad that experience with manual therapy and deep soft tissue work is mandatory. Once they come in, you want to get very specific. No reason to beat around the bush. Once you start narrowing down your candidates, then let them know. They're going to, need to coordinate, delegate, supervise responsibilities, participate in training. They need to understand the office compliance manual. They need to understand the office policies and procedures. They need to know the reason why they're going to be ordering and directing. For example, if you're going to have a medical doctor doing, let's say, joint injections, you want to make sure that the medical doctor reads the insurance company policy on joint injections. If you're going to have your PT prescribing back braces, well, make sure you have the PT read the insurance company policies on back braces. And then we have, credentialing. Do you want your MD, PT, acupuncturist to be in network, out of network. Credentialing could slow things down. Individual managed care applications could be time consuming. Contact your existing plans. If you are in network with any plans, contact the existing plans that you're in network with and let them know you're bringing on some other healthcare professionals and you also want them in network. Find out what their rules and regulations are. Some are strange. There are some Blue Cross Blue Shield plans that say, oh, we'll pay for a chiropractic treatment, but if you bring in a physical therapist, we won't pay the physical therapist. The physical therapist has to have a standalone facility in order for us to pay a PT. You know, there are some strange rules, but most of the time it works out. Medicare, if you're going to have your PT or MD seeing Medicare patients, make sure you get that 855R form filled out to reassign the benefits. A little bit about Stark and anti-kickback. Stark law prohibits a physician, an MD, DCDO, from referring patients to an entity which you have an immediate family member or some sort of financial relationship for certain designated health services. So be careful about that. Anti-kickback statute, also be careful. There are some safe harbors to the anti-kickback statutes. So, just be careful with this. For example, if an attorney approaches you and says, hey, I'm going to refer patients to the practice. We get tons of new patients. We're going to start referring patients to your practice. Every patient that we refer to you, you would need to give us $300, some sort of arrangement you get approached with like that. No, run away from that. There's a reference right there on anti-kickback statutes. So yeah, credentialing, managed care plans, and take a look, do a little analysis. Are you better? Maybe you're better off being out of network. Now, I'm not telling you to join plans. I'm not telling you to drop out of any plans. There are pros and cons to being in network, pros and cons to being out of network. We're not going to get into all of those today, but do your due diligence on that. Let's talk about some of the most common services that are rendered in a DCPT MD practice. Because most chiropractors are neuromusculoskeletal practitioners, pain being one of those conditions, your most DCs that integrate just naturally stick with the pain management, conditions, and pain-related patients are coming in for neuromusculoskeletal conditions. So it's very natural to bring on a PT for most chiropractors, but that doesn't have to be the case. I mean, with me personally, I didn't go from chiro to PT first. I went right into cardiovascular disease. So I brought in a medical doctor to treat specifically cardiovascular problems. But I understand that most chiropractors will look to PT. So there are certain supervision levels, personal, direct, general. If you're going to see Medicare patients with your PT and you're going to have a PTA, then the PT has to be on site when the PTA is performing the service. I'm not a big fan of a patient coming in, seeing the chiropractor for a neck problem, and then seeing the physical therapist for the same neck problem, and then seeing the medical doctor also, and we have concurrent care. Careful with that. It can cause a red flag. These are the PT evaluation codes. There are 3 levels. And here's the reevaluation code. There's 1 reevaluation code. MDs and chiros, we have 5 reevaluation codes, right? PTs have 1. And the reevaluation service is similar to the reason why we would do a reevaluation as a chiro or an MD, because the patient has had a lack of improvement, or the patient has substantially improved, or there's a new problem. So a discharge. So those are the main reasons to do reevaluations. Your PT is going to be trained and is going to know how to do supervised modalities. The top 3 are the most common: hot, cold, Traction, unattended electrical stim. This is the application of a modality that does not require one-on-one contact. They're not time-based. Your PT will probably be experienced and want to do some of these constant attendance modalities. These are time-based. These are one-on-one, the most common being ultrasound. Some practices include vibration therapy. This is not a billable service unless the patient's doing an active procedure. If the patient is just standing on the platform, I don't recommend you bill it. Now, some health plans have an issue with handheld devices. These are for chiropractic services. So just a little heads up on that. Now let's talk a little bit about therapeutic procedures. PTs, these are the 4 most common services that PTs will do in an integrated practice. These are therapeutic procedures to improve functional performance. These are time-based, one-on-one. Therapeutic exercises are active. They're active procedures. The patient has to be doing something. Same thing with neuromuscular reeducation. The patient needs to be doing something. These are active procedures. Now, when it gets to manual therapy or massage therapy, those are passive procedures. The patient is just relaxing and you're doing the work. So do not bill 97110 for a passive type procedure. Make sure you tell your PT about that. Acupuncture, terrific. I brought on acupuncture into my practice when I integrated. There are 4 codes. Most acupuncturists that get paid for that insurance pays for acupuncture also pays for exams and therapies. These are the 4 main acupuncture codes. We have 97810, which is an initial visit with the patient, 15 minutes one-on-one, and then 97811 is an additional 15 minutes with reinsertion of needles. And then we have 97813, which is the initial visit with the patient, 15 minutes with electrical stim, and then 97814 is acupuncture with electrical stim for an additional 15 minutes with reinsertion of the needles. These are not unattended codes. I would want you to do your due diligence. If you've been told that the acupuncture codes are unattended therapies, for example, you walk into the room, the acupuncturist puts the needles in and then walks away for 15 minutes and leaves the patient unattended and then comes back and takes the needles out, that does not count as the 15 minutes of one-on-one. These acupuncture codes do not fall into the same rules and guidelines as the physical therapy codes where 8 to 22 minutes is 1 unit. That doesn't count towards acupuncture, and they're not like the codes in the modality section like traction and hot packs where they're unattended. These are 15 minutes one-on-one with the patient. Trigger point injections also seems to be very commonly incorporated when a chiropractor goes into integration. Here are the codes. Trigger points are focal areas of spasm. When I first started doing them in my practice, the medical doctor was not good at finding the areas of spasm. So I would find the areas of spasm and then I'd point it out literally to the medical doctor, and then he would inject the sites. But after a while, he got to know how to do it. He was getting better at palpating. So 20553 seems to be the most commonly billed trigger point injection CPT code. Yeah, make sure you are reading the policies. Very important, because if you do, one thing incorrect, you may have to give the money back. So if you take a look, Aetna says the symptoms have to persist for more than 3 months. So just think about this. Mr. Jones comes in with spasm and neck pain and tightness in his upper trapezius, and you do some, the MD or the DO or the nurse practitioner or the PA does a few trigger point injections into the upper trapezius, and the patient says, well, the pain has been there about 2 weeks. See how that could be a problem? And here's Medicare pays about $75 for 20553. This is a fee schedule. I'm not sure which state this is. Joint injections, terrific joint injections. There are small joint injections, medium joint. So small joints are fingers and toes. And then there are medium joint injections, wrist, elbow, ankle. And then there are large joint injections, like to the shoulder, hip, and knee. There are certain codes that are in joint injections without guidance, without ultrasound guidance, and then there are codes with ultrasound and guidance. So probably tell you the most common code is 20611, which is a joint injection into a knee, for example, with ultrasound guidance. Here's the fee. Medicare pays about $100 for that. Most insurance companies pay more than Medicare. Now, this is rare, but some medical doctors can do NCVs and EMGs. Most are not certified in it. You may want to hire a certified electrodiagnostic technician to come in and do the NCVs and EMGs under the supervision of the MD. So if the MD's name is going on the claim when you're billing for NCVs and EMGs, make sure that the MD knows what an F wave is. They know how to interpret these. Take a course, learn about it. Should be able to feel comfortable with it. Needle EMG. Do not use these codes for surface EMG. I know some doctors doing that, and boy, is that a problem. Needle EMG. Oftentimes, insurance companies will not pay for NCVs unless they're done in conjunction with needle EMG. Be careful with that. I'm working with a doctor right now that's being audited. It's a problem. He was doing NCV, surface NCV testing without EMG, and he was doing it against what the insurance company policy stated. So looking at possibly giving back a lot of money. Then we have nutritional consultations. So here are a couple of codes for nutrition. Now, I can tell you that nutrition, these are supposed to be done by certified nutritionists, people that are trained in nutrition, counseling, dietitians. These codes are not supposed to be used by chiropractors or medical doctors. If your MD or your NP or your associate chiropractor is going to be doing nutritional consultations with patients, you should be using the established patient E&M codes or the new patient E&M codes. And these don't pay that well. Very low RVUs. Now, the types of services that you want to incorporate into your integrated practice could be insurance-based. I could tell you most doctors that go into integration, most of the services that are part of the new integrated practice are insurance-based. It's a way to make more money. That's okay. What's wrong with that? I'm a chiropractor. I have Medicare patients coming in, and I want to do some rehab. Medicare won't pay me. Okay, so now I have a physical therapist that can do those services. Why not have the patient see the physical therapist? It helps the patient out. So the patient doesn't have to pay me cash. We're trying to help patients, right? So there's nothing wrong with providing insurance-based services that are covered in an integrated practice when they wouldn't be covered by you as the chiropractor. So that's fine. A lot of doctors are doing insurance-based services, but you could also do cash-based. Some of the things I did in my integrated practice were cash-based, like intravenous vitamin and mineral therapy. Yeah, we did that. Weight loss and cellulite reduction, all cash-based. Stem cell, hormone injections. These are all cash-based services. Simple things, even acupuncture could be cash-based. Some patients come in, they don't have coverage for acupuncture. Medicare patient comes in, Medicare doesn't cover acupuncture, so that's cash. So some things could be insurance covered, like acupuncture, and sometimes not. Just like chiropractic could be covered and sometimes it's not. But certain things are never covered by insurance. Like stem cell. Stem cell, I don't think insurance covers stem cell. So you might want to include a little bit of each. Now, in your integrated practice, make sure, if you're going to see Medicare patients, make sure you put together a compliance manual. It's mandatory. Medicare wants providers to be proactive. So maybe you as the chiropractor are not seeing Medicare patients, but you brought on an MD or a PT or an NP, and they're going to be seeing Medicare patients. Do your best to put together a compliance manual with policies and procedures, have staff trainings, enter those trainings into a training log and put that in the manual. The bigger you get, the more money you're going to be making, the more of a target you are. That's just the way it goes. If you're the big fish in the little pond, you need to have more protection. That's okay. You know, the very, very, very wealthy people have all these trust funds and offshore accounts because they have too much exposure and too much at stake. So they hire people to protect them. That's what you can do too. The bigger you get, the more patients you're seeing, the more money that's coming into your practice, the more protection you should put around your practice. One of those things is having formal policies and procedures just in case Medicare comes snooping around. Oh, let me ask a couple of questions here. Can you treat Medicare patients without being enrolled in the Medicare program? The answer is no. Chiropractors cannot treat Medicare patients unless you are formally enrolled in the Medicare program. If you're having Medicare patients come in and you're just charging them cash and you're not billing Medicare, you're performing an illegal activity. So be careful with that. Chiropractors cannot opt out of Medicare. That's right from the Medicare Benefit Policy Manual. Actually, chiropractors not enrolled in Medicare, you're not even allowed to use ABN forms. That comes right from the Medicare Claims Processing Manual, Chapter 30, Section 50.3. So we're talking about a simple manual. It could be, 10, 15, 20 pages. It has some of these essentials here. Simple policies and procedures. Conduct regular trainings. You should be doing this with the MDs, the PTs, the PTAs. Get them trained if they're seeing Medicare patients. It's mandatory. Internal reviews is mandatory. It's being proactive. Put together some sort of chart review tool, something like this. Exclusions. If you are seeing Medicare patients, you and anybody else that has anything to do with Medicare patients in your practice, go to the exclusions list. Go to the website, exclusions.oig.hhs.gov. Put everyone's name in there. And if their name pops up, then they are excluded from treating patients. So hopefully their names won't pop up. Training 3 hours per year, that's not that long. You could even use this. Those of you that, this is not a CE approved course, but if you wanted to use this as part of your training, we can send you a letter of attendance if you would like and put it into your training manual. So this is our little sample employee training log. And you just want to be careful about certain things you're doing, especially with Medicare patients. Like I know some chiropractors that will treat Medicare patients for a chiropractic adjustment and bill Medicare, but if they have to do something else like an extremity adjustment or take x-rays or do an exam, they don't charge for it. They want to be nice to the Medicare patients. We're only going to bill Medicare for the spinal adjustment. The other things we do, and we're going to give away those things for free because we want to be nice. You might rethink that after looking at this. This is a chiropractor that had to pay nearly an $80,000 fine because he was giving away free electrical stim. This doctor has agreed to pay $79,919 to resolve allegations that he violated the False Claims Act by improperly billing Medicare for chiropractic adjustments after providing free electrical stim to patients. This just happened. I think this is the first time I've ever seen something like this. So it's probably not going to be the last. So just get protected. Make sure you know the difference between Medicare and HIPAA. HIPAA is about protecting patients' private health information. That's more important nowadays than ever. OIG, Medicare compliance, is about preventing billing and coding errors. HIPAA is about protecting patient health information. So HIPAA's been around a while. HIPAA applies to covered entities. Are you a covered entity? That's my question. Okay, well, I have two questions. Do you bill or receive payment from insurance companies? If yes, you're a covered entity. Do you submit claims electronically? If yes, you're a covered entity. So I would say that 95% of you listening to this are covered entities, and you have to abide by HIPAA. You're allowed to have sign-in sheets. Keep your passwords confidential. Make sure you have backup procedures in place. Can you email patients? Yes, but don't email them private health information. You want to email them an appointment reminder? That's fine. A health and wellness newsletter? Fine. Don't email, hey, Charlie, just want to remind you to put ice on your swollen knee. Don't do that over an open email. You could email patients as long as you get your IT person to protect your email conversations and encrypt it. Oh boy, yeah. I'm not going to get into all these, but there are so many things here that as far as HIPAA goes. So here, did ESPN violate HIPAA? Jason Pierre-Paul, football player, he was playing with fireworks, blew off his finger, went to the hospital. An employee of the hospital gave the information to ESPN. ESPN posted it all over their website, their Twitter accounts. So the question is, did ESPN violate HIPAA? The answer is no. ESPN is not a covered entity. ESPN doesn't bill insurance companies. So ESPN did not violate HIPAA, but they could still get in trouble. The hospital did. And here's other HIPAA violations on all these famous people. And staff members were fired. "27 employees couldn't resist looking at George Clooney's records when he was in a car accident. Britney Spears had a child, and staff members at the hospital were peeking in at her chart, so they were disciplined. And then, oops, they did it again after she was involved with some psychiatric issues. So they fired 13 employees. It's a big deal. This was recently in the news. Dr. Bornstein disclosed to the New York Times that he had a patient that he was treating for hair loss. He was giving this patient medication for hair growth. Problem is, this patient was the president. So it caused a whole firestorm on the news about Dr. Bornstein and how he released information incorrectly. So just do a security risk assessment. There's a little checklist when it comes to HIPAA. Do a security risk assessment. Find out your vulnerabilities. Have formal staff trainings. Make sure you're getting all the HIPAA forms signed. We have a HIPAA forms pack if anybody's interested in it. It goes through, we have about 21 forms. So with HIPAA, security risk assessment, designate a compliance officer, update your BAAs, have formal staff trainings. And here, integration summary. Determine the services you want to add. That's one of the most important questions. Find out. Think about, what do you want to add? You want to do physical therapy? You want to treat patients with Botox, dermatology, cardiology? Create a very strong corporate structure. A new tax ID is not ideal, but may be mandatory. Get a good team going. Once you go from chiro only to integration, you become a bigger entity, get protected. Get a good quality healthcare attorney to help you out. Get an accountant to make sure you're not violating any issues regarding independent contractors versus employees, and all your payments are flowing from one corporation to another corporation properly. Get a certified coder to help you with your billing and coding, and start interviewing people as soon as possible. So just a few closing comments. Check with all the plans prior to billing. We can't guarantee this information will guarantee payment. Thank you for attending. Here's our contact information. You could email me directly, Dr. Kotler at targetcoding.com, website targetcoding.com, telephone number 1-800-270-7044, and our HIPAA secure fax number is 1-844-831-2347. I hope everybody learned a lot. Let's take a look and see what questions have come in.